Why Harold Shipman is called Dr. Death. Many of the individuals who knew and trusted the man who came to be known as Dr. Death remarked that he was a very kind man and a cornerstone of the community. Over the course of decades, this serial murderer visited the homes of dozens of people, and when he departed, his victims were no longer amongst the living. But how persistent was his need to murder? He may have killed several people at first, then many more. The precise number of deaths is still up for debate. What is certain is that Dr. Death may have been history's most prolific serial killer. To know his story and motives, stay tuned to the crime files. His name is Harold Shipman. Although it is thought that he may have killed as many as 250 people over the course of his career, British doctor Harold Shipman was convicted of killing 15 of his patients. Shipman, a general practitioner in Pontefract, West Yorkshire since 1970, was born in Nottingham in 1946 and graduated from Leeds School of Medicine in 1970. Despite his professional accomplishments, Shipman was a difficult and demanding person. In 1998, he was fired from his clinic for falsifying medicine prescriptions. The entire scope of his offenses didn't start to surface until after he was fired. He was a family doctor in a little town, a helper, and over the course of 20 years, he developed into a man whose face most people might recognize on the streets. This bespectacled, tweed-clad physician, who may have resembled a small-town British doctor, was in fact a pillar of the community, or so it was thought. To suggest that Harold Shipman had a dark secret would be an understatement of the century. He was not only Britain's most prolific killer, but also one of the most heinous villains the world has ever known. He was known only by the names of Fred or Freddy to his friends, patients, and co-workers. If we want to try and understand how someone became a killer, as is nearly always the case with the people we cover in our videos, we might want to go back to their childhood experiences. So, what happened in his childhood? Shipman was a skilled rugby player at the juvenile level when he was younger. It is believed that his more homicidal tendencies started to rear their head when his mother died when he was just 17 years old. Years later, in conversation with his friends, it was revealed that young Fred didn't say much about his mother's battle with lung cancer and how he observed as a neighborhood doctor used to visit his house and administer morphine to ease her agony. However, it is believed that young Fred was a very loving son. His mother had gone to considerable lengths to ensure that her working-class child, raised on a council estate, which is similar to the projects, was administered to grammar school. Grammar schools are schools that applicants had to pass exams to get into, and they were primarily aimed at helping low-income students and families. Shipman made a sincere effort to win his mother's approval, and as a result, his mother grew quite proud of him. Additionally, other biographies said that she was pushy and dominating, which can sometimes spell disaster. She allegedly pushed him too hard, which caused him to become socially isolated. His mother would instill a sense of superiority in him, but this would cause Shipman lifelong problems because he might never be able to shake his mother's influence out. Fred was adamant about going into medicine, maybe still wanting to please his mother and possibly motivated by her agonizing, drawn-out death. He would devote his entire life to alleviating the suffering of others, but as we shall see, his approach to therapy may have been a bit excessive or overly comprehensive. Shipman completed his medical studies at Leeds University in the north of England before completing his hospital internship. Even though it is reported that he was a loner at the time, he met his future wife during this time period. When she fell pregnant with their first child, she was 17 and he was 19. Overall, they had 4 children. He earned his first position as a general practitioner in 1974. That is essentially your typical family physician. His place of employment was a clinic in the West Yorkshire town of Todmorden, which from the outside appears to be a lovely rural community set between valleys, what a poet would have referred to as England's green and pleasant land. However, appearances can be deceiving, as Shipman at that time was falsifying prescriptions for the opiate pethidine, even though it appeared that he was leading the ideal country life. He was also addicted to a form of pharmaceutical heroin. He was discovered and penalized, but he returned to business after some rehab. He started working in a different tiny town, Hyde, just outside of Manchester in 1977, this time on the other side of the valleys. We can't say exactly when he became a monster. If you don't subscribe to this channel, you will also face another Dr. Death. So please, subscribe. Just kidding, you're safe. There is only one Dr. Death. Harold Shipman used his status as a well-respected physician to win his victims' trust before giving them deadly amounts of medication. Shipman frequently paid house calls to his victims, giving them the medications and then fabricating their medical records to hide the murders. Most people believe that when he first arrived in Todmorden, he wasted no time and immediately began his murder spree. After his studies were over, he was employed in this little Yorkshire town. Mr. Shipman will remain there for around 20 years, and as we have already stated, he will grow to be regarded as a pillar of the neighborhood. In fact, a senior physician who collaborated with him claimed that Shipman would take on substantial workloads and that the majority of his patients appreciated him. He was rumored to be the most well-liked physician at the hospital. What could possibly go wrong? The reason for this is that many of his patients seemed to pass away unexpectedly, possibly before their time was up. Psychologists claim that because of the power that his job provided him over others, his God complex, and the persistent recollection of his dying mother, he may have developed a number of mental illnesses. However, he allegedly also committed murder when there was financial gain to be had, in one instance, someone's will. By claiming to need morphine for his patients who occasionally didn't, he was also able to access significant doses of the drug. The Guardian article said that the majority of his victims were elderly women. According to such claims, Shipman murdered a 71-year-old woman as his first victim in 1975. It was also the day before her birthday. His victims range in age from 41-year-old men to 93-year-old women. When he left that hospital and opened his own business in the same city, killing became simpler for him. The local morticians in the town of Hyde didn't start claiming that a lot of bodies seemed to be coming from him until 1998. In fact, it was quickly discovered that the amount of deaths under his hands was 10 times higher than that of the other physicians. Furthermore, many of his patients that passed away did so in the same position. The majority of the older women were fully dressed and seated in an upright position or reclined on a sofa, similar to an overdosing drug addict. According to The Guardian, the 1998 police inquiry was a complete mess since the investigators failed to cross-reference the doctor's medical records with the patient fatalities. The police investigation failed to carry out even the most basic checks, including whether Shipman had a criminal record, The Guardian reported. However, other residents of the area had him covered. Even a cab driver came forward to claim that Shipman was murdering otherwise healthy people. Also in 1998, Shipman took care of a previous mayor candidate who had some money tacked away until she passed away. After a string of incidents raised some questions about the high number of patient deaths, he was apprehended. Shipman was able to commit his crimes for a long time without being caught, but eventually a combination of events came together to alert the authorities to his operations. The diligence of a local coroner, Dr. John Pollard, was one of the key reasons that contributed to Shipman's demise. When Dr. Pollard noticed that several of Shipman's patients had died abruptly and unexpectedly, he got suspicious and started looking into the deaths. A thorough investigation was undertaken by the police, and it was because of their work that the full scope of Shipman's crimes was eventually discovered. In 1998, Shipman was ultimately taken into custody and charged with 15 counts of murder. It's estimated that he killed up to 250 individuals during the course of his career. He was convicted and given a life sentence in jail. The uncovering of Shipman's crimes shocked the British medical establishment and prompted numerous demands for changes to the way that doctors are controlled. He was found guilty of 15 charges of murder and 1 count of forgery in the year 2000, and he was given a life sentence as a result. Shipman hanged himself in his cell shortly after he was imprisoned. So, what would you do if you saw Dr. Death today? If you want to see more videos like this, make sure to check out our channel for more niche-related content. Also, remember to subscribe to our channel and like this video. I will see you in our future videos. Until then, goodbye.